programs. And we've also spent some time on Capitol Hill talking with the people in Congress who make decisions about healthcare funding so that they understand what the scientific opportunity is, and also the oversight of federal programs, helping them help us be good watchdogs for the federal dollars that have been spent on CFS. Last month we traveled to Japan together and visited with a very large research group of about 50 investigators studying CFS in Osaka City and Kobe, Japan. And that was just a tremendous trip that inspired and gave us a lot of hope for the progress that's being made in other countries that we may help literally translate into progress here in the U.S. and other countries. At about the same time, we received 35 letters of intent in response to that request for applications that we put out. Investigators literally from 9 countries with $3.3 million in funding requests. And now we are in the process of inviting back full research proposals that will be received in August and reviewed for both scientific merit and strategic opportunity this fall. So that's kind of the quick and dirty part of the research initiative that's literally just been underway for about 6 months now. So it's been a whirlwind. It's been a whirlwind 6 months. And what it boils down to really is this feeling of, with this 20 years of scientific study and discovery and publication, we need to move things forward and accelerate the pace at which research is moving, to build that critical mass, to attract those new investigators, to engage new institutions in the study of this illness, so that we can move from that very lethargic, ineffective medical system that was on the first of those several curves that Suzanne showed, and turn it into the more efficient, effective healthcare system for people who have CFS. I don't need to tell anyone that's on this line today that what we have in terms of medical care delivery is just simply not working, and managed care, I think, has only made the situation worse. But we are working toward that, and we see the association's role as sort of galvanizing the field and moving things forward faster than they used to move. But in order to do that, we need your support. We have created this $1 million research goal for this year, and raising those funds, and I'm very pleased to say that as of the end of May, we are at about $670,000 toward that $1 million goal in funds pledged and raised in support of this initiative. So obviously it's attracted a lot of support from people within the community, and we know that while $1 million is a very ambitious goal, it's just really the beginning of what we need to do in order to make CFS diagnosable, treatable, and ultimately preventable and curable. And that's really the bigger goal here. And opportunities like this to share this information with all of you are really exciting, because it doesn't happen in a vacuum. And we are doing this on behalf of the 4 million people who are affected, only 80% of whom even have a diagnosis. So we fully recognize the challenge before us, and we hope that we can count on the support of the patient community and the association's members and subscribers to help us toward that goal. We have literally received over 100 questions. And while Suzanne was talking, I was madly trying to answer some of the ones that were about volume problems or not being able to hear the presentation. One question that came in quite frequently is whether this presentation will be either offered again or available somehow. We are attempting to record it. We hope to be able to post it on our website, and I've got up here the URL for where you can find some other resources about CFS and the research campaign in particular on our website. But we do hope within the next few days to be able to post both the PowerPoint slides that you've seen on your computer and the audio that you've seen as a PDF. I don't think it will be downloadable, but you should be able to view it. We've also had some questions about case definition, and it's really hard. The questions are coming in faster than we can even read them, and maybe you could just talk for a minute about the case definition and the effect of the case definition on how patients get studied. There's the sort of international case definition, which defines CFS. There is a definition that was created by a Canadian consensus group that was designed more for clinical care than it was for research, and there have not been many of those 4,000 studies that have used the Canadian definition to classify CFS patients. And now there is another criteria called the empiric definition that is only being used, I believe, by the CDC research group. But how you choose the groups is definitely a big part of why we see differences from study to study. And there is a big effort toward refining the case definition and also subgrouping. And I think subgrouping is really part of the way forward.
Right, and I think the biggest issue with the case definitions now is that they are based on self-report subjective symptoms. So it's all self-report measures. And that was useful when we first started studying CFS in order to be able to try to get estimates of how many people were sick with CFS, and perhaps to begin to study some of the pathology. But now it appears that the symptoms that are actually in the case definition for CFS are quite non-specific, and they're found in a number of different chronic diseases. And there is a move now to be able to objectively subtype and stratify that kind of whole mixture of CFS that I showed you in a couple of the other pictures, in addition to trying to identify specific markers for some of the overlapping conditions. In other words, fibromyalgia or irritable bowel, a lot of these types of conditions that share a very similar symptom spectrum. So I think there are problems with the case definition. It's too subjective. We absolutely need to be able to move to more objective approaches for identifying CFS and some of these other chronic conditions that appear to overlap and co-occur with CFS.
There have been a few questions about infectious agents, and the perception, at least, that the search for infectious agents as a cause of CFS has sort of gone dead. And I think the way I would respond to that, and I'll let you also respond to that, is that at the International CFS Research Conference that was held in January of 2007 in Fort Lauderdale, sponsored by the IACFSME, the search for